I'm going to tackle today a pretty complex and challenging topic, indeed a controversial topic, and that is the one of medicinal cannabis for pain management. So I wanted to cover off a couple of things in relation to this, and I'll preface it by saying that the evidence is changing. So what I'm saying today really is of correct nature as of November of 2024. So I wanted to cover off on what is medicinal cannabis, who gets prescribed it, and how is it taken. So those are the three areas we want to look at today. So medicinal cannabis refers to extracts of the cannabis sativa plant, or just the raw nature of the cannabis sativa plant itself. And there are quite profound and fundamental differences between the raw product, which is generally referred to as whole flower, entire flower, or the extracts. And the extracts are really looking to extract two of the main ingredients that are present in the cannabis plant. That is THC, and the other one is CBD. And they can then be mixed together or in certain ratios, or they can be in isolation, that is not combined. Typically, for pain medicine, we look at CBD oil as one treatment, and then we also look at THC CBD oil as another treatment. Typically in pain medicine, there is not a large amount of use of the whole flower, typically because what we see with that is that there is much more THC than CBD in the whole flower, and so you tend to see THC side effects occurring to people, which includes not being able to drive and then feeling drowsy and so forth, or cognitively affected. But we need to acknowledge that what we're seeing is amongst many different practitioners, including large numbers of general practitioners, being asked by their patients for the whole flower rather than the extract products. So CBD oil comes as a certain strength, and THC CBD typically comes in a ratio of 1:1. That is, there is one molecule of THC with one molecule of the CBD. And the reason in pain medicine we tend to use this blend in a 1:1 ratio is because we see a synergistic effect in terms of reduction in pain, and we also see a synergistic effect for reduction of the side effects of the THC. So if it's kept below a certain level, which is generally 20 milligrams per day, we don't tend to see the same cognitive side effects and drowsiness and so forth that is seen when people consume a whole flower product. So those are the two major forms of the oil that's used in terms of medicinal cannabis. Then the question comes to, well, who is this actually useful for? And then it becomes even trickier, because the evidence becomes a little less certain in terms of what the evidence base is for who this is useful for. But from what we're able to determine, whether it be the CBD oil or the THC CBD combination, the more a person has nerve pain, the more likely it is to be successful. So nerve pain compared to, say, arthritis pain, for example. And the more that nerve pain relates to nerve pain arising from the central nervous system, so that's the brain and spinal cord, for example, rather than a peripheral nerve, we see a higher rate of response again. So our highest response is in people who have what we call central pain, that is pain of the central nervous system. So that might be after a stroke, for example, or after damage to their spinal cord, for example. And we see a response, but less, with peripheral nerve pain, and we see a much lesser response again when it comes to things like arthritis. So how effective are these drugs? Because certainly in the lay press or in people who are wanting to advance the cause of medicinal cannabis, they'll say it's effective for everyone. Well, let me say that is certainly not the case. We have various ways of assessing the degree of effectiveness of something, and one of the important ones is derived from our clinical trials, and we call that the number needed to treat. That is, how many people do you need to treat with the product for somebody to benefit who wouldn't have benefited if they just got placebo. And it would appear that for the medicinal cannabis products, we're probably looking at something like a number needed to treat of between 4 to 8. There's a little bit of imprecision amongst those numbers, but between 4 and 8. And that is no more effective and no less effective than a number of our other prescription medications that are used for neuropathic pain, for example, which often have a number needed to treat around 6. Meaning we need to acknowledge that for many people receiving a trial of medicinal cannabis, they'll find it's actually not effective for their condition, but a number of people will find it effective for their condition. So I think that's the first thing to say as regards that. Now, in terms of looking at then the actual prescribing of it, it needs to be prescribed by, here in Australia, a medical practitioner. And it's not something that you set and forget and get for the rest of your natural life. It's really should be treated like any medication. Do you derive benefit from it or not? Do you experience side effects or not? Is the net outcome beneficial, or do the side effects outweigh the benefit that's occurring, for example? And at the end of a period of trialing it, whether that be 4 weeks or 6 weeks, for example, your doctor and yourself need to make a decision based on the evidence that we see from that trial. And where the trial is negative, then obviously there's no purpose, there's only disadvantage to continue with the treatment if you can only be exposed to side effects and not being exposed to benefit. One of the ways we look at medicinal cannabis is that overall, as pain doctors, we wouldn't call it, a great analgesic. We would actually look at it and say it's actually an analgesic of sorts, but it has extra features that are not found in our standard analgesics. So besides the reduction in nerve pain for some patients, we also see that it can improve sleep, and we also see in those who have an underlying anxiety disorder or symptoms of anxiety, it can reduce anxiety. So it kind of does 3 things at once, which is unusual for an analgesic, which normally just provides some partial analgesia. So our best results are when we can find a patient who has insomnia, often due to pain, and anxiety, and has nerve pain. And if we can find that triple combination, that's the best bet in which this drug can be trialled and which the greatest success is found. So we kind of look at it in that sense. And certainly from anecdotally, my own experience now of selected prescribing now for over 8 years now, one thing it seems particularly good at is reducing what we call dysphoria. And dysphoria is a funny term. It's not a common term that's used in everyday parlance, but it refers to that agitated sense of distress. So it's not exactly anxiety, it's not exactly depression, but its own state of disequilibrium, if you like. And this drug, medicinal cannabis, whether it be the CBD oil, which is usually trialled first, or the THC CBD, seems to be particularly good at reducing this sense of internal turmoil or dysphoria. Then, if we go on to look at the actual prescription, the prescription occurs in a standard manner in terms of a prescription script pad and obtaining it from a chemist and again, obviously trialling it. So some information therefore around medicinal cannabis. It's not a be-all and end-all, it's not a universal salve by any means, but in selected cases where your doctor's able to talk to you about the pros and cons, it may be something that may be appropriate to be considered.